I want to talk to you today about the results of a study that we have been engaged in for the last 3 years. We're almost finished. We finish in a few days. And it's looking at factors influencing home care nurse intention to remain employed. So I'm going to talk to you a little bit about that over the next 45 minutes or so. And for those of you in the room, please do not hold your questions if there's something that you want to ask before we finish the presentation. We're really good at that, so we can answer that. This study was generously funded by the Ministry of Health here in Ontario, and the co-investigators and people working on this study include myself, Jody McDonald, who is a faculty member here and a home care nurse by background, Lisa Cranley, who had done her PhD here and has done a lot of retention work with me, retention research over the past number of years, May Squires, another PhD student who, my first PhD student who graduated, who also had done a lot of work in our retention studies across the years. Heather, who is here and introduced herself earlier, Heather Thompson, Margaret Sari, who is here and introduced herself earlier, and Erin Parazison, who's not here right now, but also worked on this study as well. So what do I want to accomplish in the next 45 minutes or so? I want to give you a little bit of an overview of the study. I want to describe some of the study findings to you, and I'd love to get your comments and your feedback as well. So let's start with the background. So what's all this about? Why are we interested in studying nurse retention? Well, first of all, we are already seeing the impact of an inadequate supply of nurses across the Canadian healthcare sectors, not just home care, hospitals, long-term care, everywhere. There is a shortage of nurses in this country. It is projected by Gail Tomlin Murphy that by year 2022 we'll have an undersupply of 60,000 nurses in Canada, which is daunting. That may not be a lot for the United States, which is a fraction of our size, but that is huge, and a huge proportion of not able to fill positions of nurses. Now, the number of home care nursing workforce has actually fluctuated over the years. It goes up and it goes down. According to our Nursing Health Services Research Unit statistics, in 1999 to 2005, there was a decrease in approximately 2,500 nurses who worked in home care. So the number of nurses working in home care went from 7,500 down to about 4,700. That started to grow a bit in 2006 to 2010. It fluctuated, the numbers fluctuated somewhere between 4,700 and 5,000, not a huge increase. But by 2011, that had increased by approximately 500 to about 5,500 home care nurses. Still not a huge number of registered nurses working in home care. And of course, recruitment and retention remain a challenge in the home care sector, particularly related to wages and benefits that are not in parity with other sectors in the healthcare system. That's a huge issue. According to the literature, before we started this study, this is what the literature told us, that there's an insufficient supply of home care nurses, and that was only going to get worse because of a number of things. The first thing, of course, is the dissatisfaction with pay and benefits and the availability of higher pay in other healthcare sectors across the country and internationally, actually. Dissatisfaction with workload, an uncontrollable and unmanageable workload, and of course a lack of full-time opportunities. We tended to invite people to work casually and part-time rather than full-time. And many men and women who are nurses actually need full-time employment. Some of the reasons that nurses decided to stay in home care nursing were things like preceptor-based orientation. Nurses in the past have reported loving that opportunity to have preceptor-based orientation. They they preferred it when organizations had organized and supportive office environments. Remember, home care nurses don't work out of an organization, they work in patients' homes. And so the only place that they have to get materials that they need is in the office of the home care agency. They are attracted to the patient-centered mission and vision that home care offers. They are attracted by the support for education, and of course they're attracted by when there's adequate staffing. So what did we set out to do? We set out to develop, test, and refine a model of factors influencing home care nurse intention to remain employed. Now, intention to remain employed is a huge precursor of actual retention. Intention to remain employed is the attitude or the perception that they're going to remain. Retention is the actual staying or leaving their current employment. So what did we design? We designed a 3-phase study, and we're in the final few days of the last phase. And the first phase was focus groups. We decided to go back to home care nurses, start there, not go back, but start there. And the literature is very scarce. There's not a lot of literature or research about home care nursing, home care nurse work environments, home care nurse responses to their work environment. There's not a lot. And we went to home care nurses across the province, and we asked them to identify what factors influence their intention to remain employed or not. And we developed a theoretical model at the end of that identifies all the influencing factors, and I'll show you that when we get to the results of that stage of the study. The second phase is we took what we learned in the focus groups and what we learned from previous research literature, and we developed a survey to send out to nurses who work in home care to test our hypothesized model that we had developed at the end of phase 1. And so we were testing and then refining the theoretical model. And in the third and final phase, which we're in right now, we are asking key informants, and you are a group of our key informants, to validate and help us interpret the findings. So what did we do in phase 1, which occurred in 2011-2012? We conducted 6 regionally diverse focus groups with nurses from 3 Ontario home care agencies, and we included RNs and registered practical nurses as well. We were intending to do more focus groups, but by the time we got to actually the second or third focus groups, we had already reached saturation, and so we were hearing the same themes repeatedly and consistently and very clearly. So we did stop at 6 focus groups, and we asked one lead question. Of course, we had this interview guide all decided and developed in case people didn't respond to our questions. We had these probing questions. We didn't need any probing questions. We asked one question, and then nurses took it away and then told us what they wanted to tell us, and here's what we asked them. What factors in your work or life influence your decision to stay or leave your home care position? We had 49 home care nurses who participated over the 6 focus groups. 26 were registered nurses, and 23 were registered practical nurses. 32 were from baby boomer generations, or even there might be a couple of silent generation, older generation nurses in there, and we're going to explain the generations a little bit later in the presentation. 7 were from the Generation X generation. They're right now about 30 to 40-ish in the age range. And 10 were from that youngest generation, Generation Y, that are just starting to flood the market. I don't mean flood, that's not the right word. I mean trickle into the marketplace. And they're the youngest nurses, and they're about 30 and less. Would that be right, Margaret? 32 and less. The average number of participants per group was 8, and the size of the focus groups ranged from 4 to 10. And the content of the focus groups was, what we do is we tape them, and then we have somebody transcribe them by word, and we analyze these and categorize the findings into what we call groups of themes that we heard throughout the focus groups. So what did we find? We found 6 big categories, a whole bunch of little themes within the categories, but 6 big categories of themes. The first one, I'll describe them in a bit more detail in a minute, were job characteristics, things about the job. Work structures, things that supported their job. Relationships and communication with patients, families, healthcare team members, CCAC, case managers, all that kind of thing. Work environment, the patient's environment, the home environment in which they work. Nurse responses to work, and the conditions of employment. So I'll tell you a little bit about each one of these. We have a paper published about this already, so I'll refer you to that paper at the end. What did they love about the job characteristics of a home care nurse? They loved and appreciated the patient variety and skill mix. Every single focus group talked about what was so great about this job was that no day was the same, no patient was the same. They had lots of variety in the patients that they saw, and they had lots of variety in the knowledge and skill that they had to use when they provided patient care. They enjoyed generally working full scope. People felt that they were able to practice and apply more of their knowledge and practice more of their skills in the home care setting than they might have elsewhere, where they sometimes felt that they were inhibited or prohibited from using their full scope of nursing knowledge and skill. They valued their autonomy, but they were concerned about decision-making authority. You could always feel some tension related to their supervisors and decisions related to patient care and supervisors and CCA case managers. There was usually some sort of tension related to that. When they talked about work structures, they talked about how they valued continuity of care, that in home care settings they really did get a chance, not always, but they often got a chance to provide continuity of care to their patients. They were able to follow that patient for weeks or months if necessary. They generally liked, when they had it, flexibility in scheduling their work. That doesn't mean they're going to be off tonight and on tomorrow morning. It meant that usually during their day, they structured their day. I'm going to see Mrs. Jones, Mr. Phillips, and Mr. whatever. Then I'm going to stop at the Starbucks at the corner of such and such and have a pee break. And then I'm going to do this, and so they were able to structure some parts of their days, usually, but not always. They felt overwhelmed by their workload. That was a consistent theme. Workload was a huge issue, trying to get everything done in a timely manner, but also trying to attend to their patients' needs. Because in home care, you're almost told to focus on this need, and you're not supposed to go and say, well, the patient has 14 other needs. We're not here for that. We're here to focus on this one or this two needs. That's a challenge for home care nurses. They were challenged by the use of technology, and I would say by the availability of technology. It was different across all the agencies that we visited. Some agencies were quite technologically equipped, others not so much. Even if they were technologically equipped, nurses often complained about what were they thinking of? How can I enter this into a BlackBerry? Well, my thumbs don't work that way. I mean, I'm going to have repetitive stress syndrome in my fingers because of how I have to. Anyways, there were lots of issues related to technology, and sometimes they were frustrated with client expectations related to how the system was structured, such that. So in the hospital, you know how we're discharging patients as early as, you're barely off the OR table and we've got you out the door. What happens is sometimes nurses and physicians and OTs and physios inside an organization, a healthcare institution, might tend to promise things to patients that would not be delivered in home care. Don't worry, we'll have a nurse come and see you 5 times a day. That's not going to happen usually. It doesn't happen that way. So sometimes they were frustrated by not being able to meet clients' expectations that were not realistic. When they talked about relationships and communication, they talked about valuing their relationships with patients and families above everything. They felt that as though physicians generally valued their input, there was really generally a good feeling about physician collaboration. They had mixed feelings about the level of support from their supervisors. That was very clear. There were some organizations in which clearly it was outstanding, but generally there were other organizations in which that support was not felt. In fact, they sometimes thought that supervisors would get in their way of delivering good care. They valued their relationships with nursing colleagues. They had nobody else to rely on but each other. When they were faced with a difficult client situation, not always, but generally, the only persons they could call were their colleagues. There are some home care agencies where nurses could call their supervisor or a specialist in an area, and that was wonderful and exceptional, but that was not generally the norm. And they had mixed feelings about the relationships with case managers. We heard a lot about case managers. Everybody talked about the CCAC case managers, and sometimes that relationship was perceived to be very positive, sometimes not so positive, but it tended to be uniform within each focus group. So if the focus group was positive, everybody was positive about the case manager because there was a regional way of working together. But where there were instances where it was negative, they were all negative about it. And that's just the way it was. When they talked about the work environment, they talked about being concerned about some aspects of their professional practice environment, less and less training they thought they were receiving for new people, less and less continuing education for themselves, and less orientation. That was more pronounced in some organizations than others. They were very concerned about some aspects of their physical work environment. The travel demand can be onerous when you're a home care nurse. When you work in a remote area, sometimes they're traveling 400 and 500 kilometers a day. I know it's hard to believe, but they do. It's unbelievable where they travel. They may travel an hour and a half to get to a client's house, and then they have to travel back an hour and a half. So it is very unusual. And of course, sometimes there were issues related to access to resources, sometimes there were not. And they often were worried about their safety, their own personal safety. You are going into an unknown environment. There's nobody there to help you or support you. You're going into somebody's home, and you're their guest in the home, and sometimes there are unsafe situations that they face. Well, not sometimes, regularly actually, you'll see in a few minutes. And when they talked about nurse responses to work, they were challenged to find work-life balance. They felt that work infringed into home infringed a bit into work, but primarily work infringed into home, and that was how nurses described having to go home at night or in the evening or in the morning, whatever they were working, and order supplies and make arrangements for clients, etc. That's the kind of thing that they did that impinged on their family life. But one of the most consistent things we heard was how they valued the meaningfulness of their work. And you'll see how high they rated that when we go to the next phase of the study. It was unbelievable. When they talked about conditions of employment, they were generally concerned about some of the conditions: employment status, being able to not being able to work the preferred status, whether that be full-time or part-time. They talked about union. There was lots of chatter about union status, not that they wanted to get unionized, but some of them said maybe it would get better if we were unionized, but that was not necessarily an outstanding theme. What was a big theme was income stability. Nurses said, I do not know what I'm going to make next month versus last month versus the following month. And this wasn't a few nurses. This was a consistent pattern. So income stability is an issue when you're not full-time and when you are working by the number of clients that you see and you're dependent on the status of the home care agency's budget. Because if the budget's all spent by the end of February, there are no patients that get seen in March, and so that's a reality. I suspect March is a tough month for home care nurses because there's not a lot of work for them. Well, that's not true. There's probably a lot of work, but there's nobody to pay them, so that's an issue. Pay and benefits was a condition of employment that self-explanatory. They don't make as much money as other sectors. Absolutely huge difference in income, and of course, if you're not working full-time, you may not have access to benefits, etc. The requirement to do unpaid work, nurses talked about when they go home in the evening and they're requesting supplies and services for their clients, they consider that to be unpaid work. And if the other one is out-of-pocket expenses, nurses consistently talk about, well, I have to buy my own supplies. And it's not it's not consistent, but regularly nurses in the focus group talked about having to purchase their own oximeters, even their own stethoscopes, their own equipment that they needed to provide patient care. So this was the model that we developed. We took all of the information from the focus groups that were thematic, that we heard over and over again across the focus groups, and we created this model. And each of these, if you look around a lot around the top, those are our categories are written around the side. So it's just the themes that are inside the grouping categories. And most of them I mentioned. And we predicted that all of those things, because the nurses in our focus groups told us that, we predicted that they would all influence home care nurse intention to remain employed. So in our second phase of the study, we wanted to test that model, that ridiculously large model that we had developed. And we developed and sent out a survey between 2012 and 2013. We mailed the survey to 1,735 Ontario home care nurses. We received back a total of 887 usable surveys. We received more, but some of them, they weren't working in home care anymore. They didn't meet the criteria, the eligibility criteria. The response rate was actually very good at 57.3, which for this day and age is actually very good. It used to be not great. When I first started out in 1999, 2000, we were getting response rates of about 65 to 70%, not anymore. We had, I can't believe it, a 19-page survey, and people answered the whole 19 pages. We were blessed. And we asked things about their intention to remain employed for the next year, 3 years, 5 years, until retirement. Just all of those variables that were on that big chart, we measured them. We found a way to measure each and every one of them. So let me tell you a little bit about, let me stop for a second. Are there any questions so far? We're good? Okay. I'm going to tell you a little bit about the sample and some summary statistics about some of the variables that we included in our model. So the sample. The average age of the home care nurses who answered our survey was 45.6 years of age. They were on average 17.7 years away from what they considered to be their retirement date. We didn't tell them when it was. We said, you know, how long are you going to be working until you retire? They had been in their job for the past 8.4 years on average. And we broke it down by generation. Veterans, the oldest generation, there were only 4 because we actually had 25, but we had to remove 20 of them because they had said that they would be retiring within the next 5 years. So we removed them from the analysis. We kept them in for some of the stuff that we talked about, but we removed them from the analysis because they were planning to leave anyway. And the baby boomers was the big hunk of people in that sample, and which is typical. Right now, the baby boomers are the largest proportion of people in the workplace, in any workplace, well, except for the tech industry. It's always Generation Y, but generally. And 94.5% were female, which is typical of the College of Nurses of Ontario statistics. And in fact, Margaret assured me today that our breakdown of the baby boomer veterans of our generation is very similar to the College of Nurses of Ontario statistics. So it's actually quite a representative sample of home care. The proportion of our registered nurses was 58.9% and 41.1% were RPNs. That is typical in home care in Ontario, so again, very representative. The proportion of full-time people was 52.5, which is quite low when you compare it to other sectors, but very typical when you compare it to the whole home care sector as a whole. And then unpaid hours, nurses, we asked them because they told us we work a lot of unpaid hours every day. We asked them, how many hours a day on average do you work, extra hours that you don't feel are unpaid? And overall, over the entire sample, they said 1.2 hours a day do they work extra hours. And when we asked them what their travel demands were, how many kilometers a day that they actually traveled, the average was 74.62 kilometers. And I don't know what the range was, but some had very few kilometers, like in Toronto Central, people actually walk. Sometimes they walk or take public transport, whereas up in Haliburton or up in Thunder Bay, they're not walking. They are driving from little town to smaller to village, and so there's a lot of discrepancy in that. So I'm going to tell you some of the descriptive statistics from the survey. When we asked nurses what their intention was to remain employed in their home care organization for the next 5 years, now the color coding should tell it all. So the big hunk there is the 37.3. 37.3% of them said, I'm very likely to stay for the next 5 years. That's actually good news. 17.8%, the kind of reddy one at the bottom, said, I'm likely. I'm not very likely, I'm just likely. And then 25.5%, the big green chunk here, said, I'm not really sure. And then 9% said, it's unlikely I'm staying for 5 years. And then the 10.9% up at the top, the lighter blue, said, it's very unlikely I'm going to be here for 5 years. So let me tell you, just so you can situate the generations in the workforce, and maybe I should have told you this before, the people who are going to be listening to this on the tape are going to have to cover their ears, because I can't tell you how many times I've hit that thing, and I apologize. Veterans were those, it's the oldest generation generally in the workforce. They were born before 1945. Baby boomers is the biggest cohort of people in the current workforce, and they are starting to retire. They were born between 1946 and 1964. I'm a baby boomer. Generation Y was born between 1965 and 1979, and Generation Y, or the youngest, the millennials, were born 1980 and sooner to us. So we asked them a couple of things. Their intention to remain employed in home care by generation. So we asked them about whether or not they're going to stay employed for the next 5 years with their employer or in home care at all, and for 5 years. And then, are you going to stay with this home care employer until you retire? And then we said, are you going to stay with this in the home care sector until you retire? And it's very interesting to see, and what we did here is we wrote down the mode, the one most frequently chosen by person. So people are more likely to stay employed in the home care sector than they are to stay employed in the home care agency for which they worked. That was clearly pointed out to me by Margaret earlier today. But still, if you look at the youngest generation, that Generation Y, they're the generation that are not as likely to remain in home care nursing. And they're the generation, as well as Generation X, that we really need to stay in home care nursing. They are the future of our nursing workforce, and yet they're the least likely to remain employed in the home care sector, both of them. So we ask things like, do you have any dependents? Because in all of our previous research, we found that having dependents was a big predictor of intent to remain employed. And in fact, about yes is the blue and no is the red. So all of these were yes-no answers. So about almost 70% said, yes, I do have dependents. And that was either children or adults that were dependent on them. When we asked them whether or not they were unionized, a very small proportion was, 17.9% were unionized. I have to tell you, it is our finding that people don't always know whether or not they're unionized or not. So when we used to survey nurses in hospitals, we'd say, are you unionized? And half the nurses in the same hospital would say, I'm not unionized, and the other half would say, oh, I'm unionized. So sometimes we don't always know that we're unionized. We asked whether or not they worked in a not-for-profit or a for-profit agency, and as you know, in Ontario, both kinds of agencies deliver care to our home care clients. 47% said that they worked for a not-for-profit agency, and the remainder said they worked for for-profit. When we asked them whether they worked full-time or part-time, casual, or to elect to work, 52.5% said that they worked full-time. And we asked them if they worked their preferred employment status. So if you say you work full-time, is that what you want to work? Or if you say you work part-time, is that what you want to work? And we matched it up, and we got agreement by almost 80% of nurses. 20% of nurses are not working what they want to work in home care, but 80% said they were working the status employment, whether it was full-time, part-time, etc., in home care nursing. When we asked nurses to rate the quality of care that's delivered within or by their agency, it was actually quite heartening, to be honest. 26.9% said it was excellent. 48.8% said it was very good. So a little less than 80% of the sample thought that the quality of care delivered by their agency, by the members of their agency, was actually excellent or very good. That was very heartening. When we asked them about their own health status, we always ask them about their health status. And by the way, nurses normally rate themselves with a lower health status than the rest of the population. Nurses, 16.4% said they were excellent compared to other people their age. 33.6% said it was very good compared to other people their age. And then the next chunk in the green is those people who said that it was good. So generally, nurses rated their health as good to excellent. Probably almost 90% of the nurses. When we asked them if they see a variety of patients, we asked them to agree or not agree with these statements. 52.6% said they did, which is what they wanted. Nurses in home care loved the variety of patients that they saw. When we asked them whether they were required to use a variety of skills, 66% said they strongly agreed. So if you add the blue and the orange together, those are the people that strongly agree or moderately agree. Those are desirable conditions according to home care nurses, and it's wonderful to see that even though it's desired, they're also doing that. They have a variety of clients that they see, and they use a variety of skills. When we asked them about flexibility in scheduling, because that was one of the things that participants in the focus groups told us that they valued and would make them stay in home care nursing, 21% of them said that they strongly agreed that they did, 25% moderately agreed, and 19.7% said they slightly agreed. So about half said, yeah, it's pretty good, and the other half said, it's only so-so, and some of them said not at all. And then when they were asked about income stability, well, that's the one, this is a researcher's dream, because you'd love to see a lot of variability in a variable. Well, this one's perfectly lovely and variable. Only 10.2% of nurses working in home care thought that they had income stability, and 18.6% said they moderately agreed, and 14.5% said they slightly agreed. All the rest, which is about almost 60% said they didn't have income stability. That's shocking in a workforce of professional nurses. It's almost shocking. It's almost unheard of. You won't get that answer when you ask hospital nurses or even long-term care or complex continuing care. It's kind of one of our disgraces, I think, actually, as a we in our healthcare system. And there's a whole bunch of good reasons for it, but are not good, legitimate reasons, but it doesn't make it right. The nurses talked about how their agencies fostered continuity of care. We asked them, how much they agreed with how much continuity of care was provided in their agency. And about half of them agreed strongly or moderately agreed, which is wonderful. That's what they value. When we asked about whether or not clients have realistic expectations, actually they responded more favorably in the survey than they did in the focus group. And more than half of them said that, our clients tend to have okay expectations of what the home care experience should be like. When we asked them about whether or not they had a manageable workload, of course that swung the other way, another nicely good variable that has a lot of variability. Only about 25% thought that they had a manageable workload, that they strongly agreed or moderately agreed. The rest of the sample went from slightly agree all the way down to strongly disagree, and the biggest group was the group that said strongly disagree. I cannot and do not have a manageable workload. And the last one on this page is we asked about whether or not they had the ability to develop a therapeutic relationship with their clients. And despite all the hardship and the issues related to a whole bunch of stuff, that almost 80% of those nurses, or even a little bit more than 80%, said I can still develop a therapeutic relationship with my clients. When we asked them about whether physicians value their input, another not really kind of nice response. When I say nice, heartening, it means that some things work well, and that is more than 50% said yes, they either strongly agreed or moderately agreed that the physicians valued their input. That was similar to the case managers. Even though there was lots of complaints about case managers, there was more than 50% of the sample felt that case managers did value their input. It would be lovely to see 100%, but that's not. But that isn't as bad as we expected based on the focus groups that we held. When we asked about work as meaningful to me, this is probably the most heartening one of all. Almost 95% of nurses said that the work they do as home care nurses is meaningful to them. Either they strongly agreed or moderately agreed. Probably it's, they talk about that as the most important reason that they stay in home care nursing. When we asked them about autonomy and independence in their practice, another variable where 80-some-odd% of them said they strongly agreed or moderately agreed that they had autonomy and independence in their practice. When we asked them about technology and how useful it is, remember, technology was supposed to come in to help us, not to make things worse. This is a sector where you can see a lot of issues, and it's not always helping them. Even born of good intentions, agencies are bringing in technology, but more often than not, from what we could tell, it was not really helping ease the workload or communicate effectively among health team providers, etc. And so only about 35% of nurse respondents felt that it improved their workflow and their work processes. The rest slightly agreed or disagreed with it. When we asked them about effective leadership and how effective was the leadership that they experienced as a home care nurse in their agency, again, there was lots of variability in that. But about 50% said that they strongly agreed or moderately agreed that it was effective leadership, but the rest said no. Now I'm going to tell you, IBM would not like that. IBM would fire all the managers because they expect 100% of the employees to say, we have effective leadership here. I'm using IBM, but you could be any up-and-coming, Microsoft, etc. We expect better than that. Our nurses deserve better than that. And when we asked them about how supportive their organization was, there was a lot of variability in that. In fact, about 25% thought that their organizations moderately or strongly supported them, which is good for that 25%, but not so good for the others that don't feel a lot of support from their organization. When we asked about adequate staffing, a little more than half of the nurses said that adequate staffing was either they felt strongly that it was they strongly or moderately felt that it was adequate. Whether or not they had a professional practice environment, that was very variable. A lot of nurses did not think that they had a strong professional practice environment, that consists of continuing education, etc. And when we asked about how they experienced work-life balance, there were lots of issues related to work-life balance, and only about 27% strongly agreed or moderately agreed that that they had work-life balance. Margaret, you had a comment.
I do. I just wanted to point out that actually nobody agreed that they had adequate staffing. The top two categories are missing. So it's actually everyone was slightly agreed to disagree that it was adequate staffing.
Now, I have to tell you what Margaret said, because you cannot hear it on the tape. And she has told me this every single time we've done a similar presentation. Let's go back to that first column on the page about adequate staffing. Nobody strongly agreed or moderately agreed that they had adequate staffing. And you'd think I'd catch myself again. That category is completely absent on the graph, on the histogram, because nobody said moderately or strongly. That 27.4% is the slightly agreed category. So it's very grim. And I don't know what I'm thinking about, why I let that go by. Thank you, Margaret. All right. We asked them about satisfaction with pay and benefits. Now here's another one that's a trick one. There's only 1.2% of the sample that were very satisfied with their pay and benefits. 20.7% were satisfied. That huge hunk of people in the green part of the pie, 39.5% were neutral, and 30.8% were dissatisfied, and 8.3% were very dissatisfied. When we asked them about external job opportunities, almost 15% said we have a fair bit, a lot of external job opportunities. That big group of respondents in the 53.4% said there were some, and then the green is a lot. So there are opportunities. They feel that they have an opportunity to leave if they wanted to leave. I wanted to tell you a little bit about the personal safety variables. We heard a lot about this in the focus group, so we included some questions in the survey. And participants reported experience an average of 4.4 of these 13 safety issues, at least regularly, not occasionally, at least regularly in their work as a home care nurse. Potential for violence with clients related to clients and families, exposure to communicable diseases, ergonomic issues, unsafe work conditions, all the way down to things like pests. And when we mean pests, we hear a lot about bed bugs, fleas, rodents, that kind of thing, bullying and belittling, incivility by clients. And so there was a long list of them, but 4.4 of those on average were experienced by every nurse regularly in their home care nurse work employment, which is concerning. When we asked them about work-related expenses, because we heard a lot about, well, I pay a lot of this out of my pocket, we asked clients if they had to pay for any of the following, things like stethoscopes. You can read that list. And we can make this available to you on our website, can we not? Yeah. Then 7.4, on average, nurses said 7.4 of these things they had to pay for on their own, related to work. Now, I don't know about you, but I never have to pay for, when I use a printer or a computer here, I never have to pay for my own printer or computer here. So nurses are saying that they had to pay for these things on their own. Now, not everybody, but it was quite interesting. So in summary, for this part, most home care nurses are female. Just over 50% of home care nurses are employed full-time, which is much lower than other sectors. The majority perceive quality of nursing care to be very good or excellent from their agency, and most agree that the work they do is very meaningful, and they have autonomy in their work. They have variety in the types of clients they care for and in the kinds of skills that they use to care for patients. There is some dissatisfaction, some to a lot of dissatisfaction with pay and benefits, and most feel the level of staffing is inadequate, and that Generation Y is least likely to stay employed for the next 5 years. That's the youngest generation. Yes.
Did you do any cross-sector evaluation of Gen Y in terms of their intention to stay employed?
We have in other studies, but we've not linked it with this data set yet. They're likely,
To think that they are more mobile?
they are much more mobile, and they're not, if you can't give me the goods right away, and I expect promotion, it's more pronounced in other sectors actually than in home care. You'll see when we're going to show you some generational comparison. In other sectors, the youngest generation looks really different. They are very assertive. They expect to be promoted. They expect to be recognized. You'll see that they're not as different in this sample. We'll show you that in a sec. So we did the regression. We took all those, the big model, and we threw everything into a regression, and here's what we found. We threw all those 37 things into the regression equation. Good news is that a number of them were statistically significant predictors of nurse and home care nurse intention to remain employed. So we were able to explain 35.6% of variance, which is good, but I have to remind you that the rest of the variance wasn't explained, so there's still lots of unknown stuff we don't know. But higher intent to remain employed was associated for home care nurses with increasing age, so that makes sense. If you're older, you're not going to change jobs as easily. That you experience better work-life balance. You have higher satisfaction with pay and benefits. You have greater continuity of care with your clients. You have greater income stability. You report a higher level of quality of care in your organization. People don't tend to want to be associated with organizations in which they feel that the quality of care is low. They have more effective leadership. They have greater variety of patients. They've been in the job longer. It's related to age. The longer you're in the job, the more likely you're going to stay. They have the greater the meaning they find in their work as a home care nurse. The greater the nurse perceives organizational support, the lower self. So when people feel that they're ill, they're more likely to remain employed. They tell us exactly opposite in the focus group. I'm going to stay as long as my health is good. But when we actually test it through survey methods, it's always the reverse. They will stay in jobs longer if their health is not great, and if they have greater flexibility in their scheduling. Those are in the order of importance in the regression, not importance, in the order of strength in the regression equation as well. So, home care nurses also, we asked two specific questions as well, because in the focus groups they said things to this, like this. If they do this, I'll stay. If they don't do this, I'm leaving. So we took all those statements and we created a list, two lists. What are the things, tick off the things that will encourage you to remain employed, tick off the things, choose the things that will make you want to leave. And we did some analysis of that, and it's quite interesting. These are the top 5 reasons to remain employed by generation. The veterans are the ones on your left, the oldest generation, and this time we put them all back into the equation, all 25 of them. And the Generation Y, which is 96, which is a healthy number, are in the most right-hand column. Those squares that are white indicate incentives that are unique to that generation. In this study, the veterans are the most different generation than the other generations. In our other studies, the Gen Y is the most different. So, for example, veterans say, I stay because of my relationships with clients and families, because the work is meaningful for me, there's flexibility in scheduling, there's client variety, supportive colleagues, etc. Whereas the baby boomers are staying because they'll stay if you give me more money. They'll stay when they have a supportive supervisor, flexibility in scheduling, etc. So the color coding is the same thing. So you'll see some similar colors across the different generations, but you'll see some differences as well. So reasonable workload was important to both the two middle generations, baby boomers and Gen X. Not as important, though it ranked down there. The other two generations chose it, but not as high a rate as the baby boomers and the Gen X. So remarkably, unlike other generations, these generations are not all that dissimilar. In some of our other work in acute care hospitals and long-term care, quite different among the generations. When we asked them reasons that they would say that they would leave employment, again, guess who stood out? The veterans stood out a little bit more than everybody else. They have 3 white boxes in their row on the left. The things that are unique to them, travel demands. If their travel demands are excessive, they will leave employment. If there's inadequate leadership, they say they will leave employment. And if they cannot find work-life balance, they will leave employment as well. Whereas the other generations are more similar. I'm going to leave if I have inadequate pay and salary. I'm going to leave if I have to do any more unpaid work. I'm going to leave if I have an unsupportive supervisor. So that was important to every generation except Generation X. Having said that, when you look at the differences in the ranking among the generations, even though they may rank slightly different, they're not all that different when you look at the rates. 69% said unpaid work would make them want to leave. From the baby boomer generation, and 63.9% in Gen X said they would leave without. So there's similarities, and there are some differences as well. So in summary, 64.4% of the variance in intent to remain employed for home care nurses is unexplained. That's the glass is half empty story. 35.6 is explained. That's the half full glass. Nurses may leave employment in home care when they have a poor work-life balance, are dissatisfied with their pay and benefits, have poor stability in their income, feel their employing organizations are unsupportive, and experience negative relationships with their supervisors. We underestimate the relationships people have with other human beings. And so usually when we ask them the first thing, what makes you want to stay in this sector of nursing? In other sectors, they always said right away, my relationships with my colleagues. And in this sector, they always said first, my relationships with my clients and families. And they would say second, my relationships with my colleagues. To promote home care nurse intention and remain employed, we need to address the unmanageable workload situation, that is to provide support for non-nursing activities, such as ordering supplies and services to facilitate improved work-life balance, address issues of pay and benefit adequacy, and implement models that facilitate flexibility in scheduling. And we need to also implement nursing care models that facilitate continuity of care. It's valued by home care nurses. That's why they're there. One of the reasons. Develop strategies to address income instability by offering opportunities for full-time employment, guaranteed hours, a regular pay, or something, so that they know what they're going to get every month. Ensure managers and supervisors are available to address nurse issues and concerns, and allow nurses to continue to use a variety of knowledge and skills by assigning clients that may vary in age, diagnosis, and care needs. One of the things that strike me in hospitals in particular, we've tried to combine expertise in one nurse. The wound care specialist, the this specialist, the that specialist, which is great in some ways, but if you overdo that, you're going to take away the variety. You're going to reduce the variety and knowledge and skills that home care nurses have to use. And implement a recognition and rewards program to further strengthen the positive feelings